Arterial supply to the upper limb only requires a few moments of our time. There aren't a lot of terribly important issues to address. The blood supply, of course, comes from the subclavian artery, which becomes the axillary artery, which then becomes the brachial artery, then divides into radial and ulnar arteries on their way to the hand. The reason that the vascular compromise to the upper limb is relatively uncommon is that the collateral circulation to the upper limb is actually quite good. So in the region of the shoulder, we have a fairly extensive collateral network with branches from the subclavian artery contributing to one side of the collateral pathway and branches from the axillary artery contributing to the other. So around the shoulder and the scapula, we have a good collateral pathway, which means that any occlusion to the distal subclavian or proximal axillary artery can be circumvented by those collateral pathways. Similarly, the collateral pathways around the elbow are quite good, with branches coming off of the brachial artery and the deep brachial artery, contributing the proximal side of the collateral pathway, and recurrent branches coming off the radial and ulnar arteries contributing to the distal component of that collateral pathway. So again, occlusions to the distal brachial artery or deep brachial artery can be circumvented by way of those collaterals. And then finally, the radial and ulnar artery both contribute to the blood supply to the hand, and typically they anastomose with one another quite well by way of what are called the palmar arches, a superficial and a deep palmar arch, each of which typically has a contribution from the radial and the ulnar artery. And in most people, compromise of either the radial or the ulnar artery will not compromise blood supply to the hand in any significant way. This, however, is an important issue to be cognizant of, because there are some people in whom the collaterals in the hand are not as good as they are in most people. And in that case, the hand is going to be dependent upon either the radial or the ulnar and the ulnar to be intact. This becomes particularly important if the radial artery is being used for an invasive procedure, such as an arterial blood sample. Before you do that, you want to be sure that the hand is able to survive without a radial artery should the artery become thrombosed. And so compression of the radial artery and ascertaining whether the hand is maintaining a good vascular supply using only the ulnar artery is an important step to take before doing an arterial stick into the radial artery. And then, of course, in recent years, the radial artery itself has begun to be used for coronary artery bypass grafts. And again, before you can sacrifice the radial artery, you have to be sure that the collaterals are sufficiently good so that the ulnar artery can support the hand on its own. That's about all that we need to say about the arterial supply.